Hey nurses, my name's Lavonne and welcome back to my YouTube channel. If you are a patient, make sure you stick around because this video is for you, but today I am answering your coffee and questions, which is typically questions from previous YouTube videos or from an Instagram poll, and today we're strictly coming from Instagram, from specifically the Bundle Birth Nurses Instagram, answering questions from labor and delivery nurses for labor and delivery nurses, but giving you, as the birthing person, an insider scoop into our world as labor and delivery nurses. Today, I'm gonna answer your questions about getting into labor and delivery, getting hired. I'm gonna answer your questions of how to navigate different patient scenarios, maybe with infant loss or position changes. We're gonna talk about becoming a doula and what that could look like specifically as a patient, somebody who's just passionate about birth, or as a labor and delivery nurse. And then I'm gonna give you my tips for labor and delivery nurses, or the best advice that I received and then I wanna give to you as labor and delivery nurses. But before we get started, make sure you subscribe down below, give it a like, share it with a friend or a labor and delivery nurse friend, and then let's get going. If any of you don't know, I am a labor and delivery nurse by background, board certified in obstetrics. I currently work full-time for Bundle Birth, and one of the things that Bundle Birth, my company, does is we train and support labor and delivery nurses all over the world. We have a 12-month nurse mentorship program. We have a physiologic birth class that I teach that's 8 hours for nurses. So nurses are so near and dear to my heart. I love them, I believe in them, and really, when you think about making change in the world of obstetrics, which is really my dream for OB, and we know that our outcomes could be better, we could treat people better. I even read a lot of your comments on previous YouTube videos, and it just makes me so sad when I hear the stories of the care that you've experienced. And then it also makes me so inspired by the amazing nursing and obstetrical care that you have received in the hospital. And so we want to bridge that gap here at Bundle Birth, which is my company. And so today I thought it would be really special that we were able to answer some nursing specific questions. Now, if you are a patient or a pregnant person or even somebody who's had a baby before, this video is still for you. I think it's really interesting to get the behind the scenes scoop and understand where your nurses are coming from, some of the questions that they have, and then that also contributes to us helping to bridge that gap between patient and hospital, which is really my ultimate dream, that we can all get along and you all have really beautiful birth experiences because of, in part, the care that you receive in the hospital setting. So I'm gonna take it to Instagram and I'm gonna answer a bunch of nursing related questions. Some of these might be from patients, a lot of these are from nurses, specifically from the Bundle Birth Nurses Instagram. So if you didn't know, we also have an Instagram that is dedicated to more nursing related education. I know a lot of my patients and friends that aren't actually nurses follow that page because they find it really interesting to see the behind the scenes scoop. And so that's what we're gonna do today. So without further ado, let me answer and try to fly through some of your questions here and answer some of your nursing specific related questions. This comes from Devin Mariah, and she says, is there ideal timing for an AROM, which is artificial rupture of membranes, or when your provider actually breaks your water for you instead of it spontaneously rupturing on its own? She says, we give them out like Oprah, and I'm unsure about it, which is true. And in a lot of places in some hospitals, they just kind of as a standard practice, at some point in your labor, they will offer you an AROM, which is a artificial rupture of membranes. So this is gonna be entirely patient specific. So one of the things that we preach at Bundle Birth and Bundle Birth Nurses is that you have full autonomy over your body. You've heard me say that if you've seen any of my other videos, that it is your decision. And so ultimately the ideal timing is really when the patient truly has a true informed consent. They understand the risks, the benefits, and any of their other options from their provider, and then they can go, yeah, it feels like it fits the scenario. Now, if we're talking physiologic birth, which is also what I specialize in, I would say that in general, we are waiting to break your water until about 6+ centimeters. And the reason for that is that, one, there's less of a chance of getting an infection, which is really the biggest risk when we talk about breaking your water or your water breaking, whether it be artificially from your provider or on its own, that then that bacteria from the vagina can creep up into the fluid surrounding baby and you end up with an infection. And so we really want to avoid that infection. The earlier you are ruptured or your water bag breaks, then the more chance of an infection because there's more time for that bacteria to grow. And so in general, once you hit that 6 centimeter mark, that's considered active labor. We know your body's doing it, like we're moving towards delivery, moving towards birth. And so that would be the time that would be more appropriate. The other thing is, from a physiologic birth perspective, is that we really want the baby engaged. So nurses, we talk about our pelvis, which of course I have my pelvis here, right? If baby is still floating high in the sky, we're worried about a cord prolapse, which is a whole side other note. But the other side that we don't think about a lot of times is if the baby's not engaged and you break the water bag, and actually let me grab my baby. Okay. So if we have our baby here and they're floating high in the sky and then all of a sudden the water bag breaks, it's like boom. And look at the position of this baby. Instead of this baby working their way down, tucking their chin, twisting and turning into the pelvis in the right way, right? So that when the water bag breaks, it's already in the perfect position to just lower into the pelvis. Versus if it's up here and then it breaks, it's like, and all of a sudden we have an asynclitic baby. We have a really lodged in a poor position situation that can slow down labor actually, because there isn't equal pressure on the cervix and the baby isn't fitting through the pelvis in the best way possible, right? And that's where our position changes come in. There's actually a position changing question coming that I saw. And so ideally 6 centimeters / baby engaged is the ideal scenario for when they would AROM a patient or artificially rupture their membranes. There are so many questions from people that would like to be labor and delivery nurses. So Cassie Davis says, getting hired in L&D right away, should I do that? I recommend that if you are a new grad nurse where you are trying to get into labor and delivery and you have the option of going directly in, a lot of times there's a recommendation to go to med surg first. And in fact, RMC Manus 15 says, do you recommend doing med surg or tele before specializing? This is going to be a flex and flow scenario. I do think that there is benefit to you having the med surg, tele, ICU experience prior to going to labor and delivery. Will it only help you? Yes. But if you know that you love labor and delivery, like this is your life stream, I actually don't think you need to specialize before you go directly into labor and delivery. And so if you can get hired right in, go for it. That's what I actually did. I've never worked anywhere else in the hospital other than obstetrics, specifically in labor and delivery. And I feel like that didn't put me at a disadvantage, but I do feel like as a new nurse, you are learning a lot. And when you add a specialty like labor and delivery, where you're an ICU nurse, a med surg nurse, a NICU nurse, a peds nurse, an OR nurse, a PACU nurse, a pre-op nurse, an ER nurse, or a triage nurse, like you're wearing so many different hats that labor and delivery, I think a lot of times gets the vibe that like, oh, it's just catching babies all day. It's happy life, which it is. It's so happy and so rewarding. But at the same time, there is a lot of actual medical knowledge that you have to know as a labor and delivery nurse, and you wear all of the hats that you potentially would specialize in another area in the hospital. You'd be just an OR nurse or just an ER nurse, right? And so that's where I think that added experience can be helpful. I don't think it's necessary. I didn't do it and I've been fine. So if you know you love L&D, go right for it, especially if you can get hired in. So many people that want to crack into labor and delivery. So along those lines, the best advice about how to crack into labor and delivery as a new grad, the best advice for new grads wanting to get into labor and delivery, that's Cassie Davis, KDP4, and then Megan K. Garcia says the best way to break into L&D with only 1 year med surg experience. Okay, so we know you want to break in because this, I will say I'm very biased, but this to me is the best place in the hospital that you can work. It's super high stress, it's super fast paced, so if you're not super fast paced and you like a more mellow side of things, I would say postpartum is probably better for you. But if you know you want L&D and you want to break in, couple of things. If I am your manager, and I actually did hire in a large hospital here in LA, I was sitting on the board and I did interview. What I am looking for is somebody who is super passionate about the specialty, that they don't waver between I might want to do this or I might want to do that. I want to know exactly why you want labor and delivery. I want you to describe the care that you dream of giving patients. I want to hear that you are there to give them the best care and prioritize their needs, to give them autonomy over their body, to participate in the shared decision-making process. I want to know that you're going to be able to go up against some providers, that you're going to be able to advocate for patients, and you're not afraid of calling them at 3 a.m. to say, hey, yo, I need you to come in. This fetal heart rate tracing doesn't look so hot. I think we need to escalate her care. And those kind of things for advocacy, I want to know that you're all in. The other thing I want to know is that you're teachable. And so how have you, first of all, how are you pursuing other learning? That means being a member of AWON, which I will link them down below. AWON is the governing nursing body for perinatal nurses. I want you involved. I want to see that you've gone to classes. I want to see that you're reading books. I want to see that you've come to our physiologic birth workshop. That's going to set you up with a killer foundation. I want to see that you're participating in our mentorship program. And in fact, we've had multiple nurses recently that have gotten hired and have put our mentorship on their resume and said that they got hired, and their manager, their new manager, said that the reason why they were hired and why they knew they were a good fit was because they were in our mentorship, which is incredible. But what that really means is that you're committed to growth. You're committed to being the best you can be. You're not gonna coast. You're not gonna participate in the gossip or the bullying, but you're there for the patient to create an environment of positivity that loves their life and loves their job and can really be a light on their unit. That's really what we're breeding with bundle birth nurses. So I wanna hear that. And then the other thing is I wanna know that you're able to function in an environment, in an interpersonal environment, okay? That you're interested in getting to know the other nurses and that you're gonna participate in positive influence on the unit as far as morale goes. I will say that nursing can be a challenging environment interpersonally. There's a lot of female energy. There can be some competition. There can be some hierarchy. There can be some nurses that eat their young. And I wish that wasn't the case, but that unfortunately is the case. And so knowing that going in, if I was a manager and I knew my unit had some of that going on, especially with the nurses that have been around for a while and they kind of have their territory, that you will be able to break in and that you're going to be able to tolerate some of that and then also ideally be a light. Now, that's a big mission. So no one's fully expecting you to come in and be like the light on the unit that totally changes the morale. But if I'm going to bring someone else in, I want to know that they fit into the culture, that they're able to adapt to that environment, and then also not participate in continuing to make that environment, because no one likes to work in that kind of a work environment. The other thing that I personally can't stand is ego, and we all have it, myself included. I'm not saying I can never be egotistical or whatever, but the idea with that is I am scoping that out, especially even for hiring for bundle birth. If you think you have it all together, if you're not teachable, if you are not open to growth, and if you feel like you have something to prove all the time, of kind of like that one up, like I have to one up you, I have to show you why I'm best or why I'm better, becomes a really competitive environment. And I really believe that whether that be in the doula world or that be in our personal lives or that be in bundle birth or in the hospital, that ego really is a toxic thing that if we can manage it, obviously like knowing your worth and saying, no, I know I care and I know what I'm here for and I feel really confident. I can say I feel really confident about my skill to educate, and that I don't have a problem saying. But when it becomes this competitive, I want you down so that I can be up, that also, and then proving your worth and kind of always having to one up, just no good. But also that's me. So your manager may be something different, but if you can show up showing humility, being humble, hungry to learn, and then people smarts is, to me, what I would say makes for a really good employee. That's also a book. If you're a manager, I will also link that book down below because that was super helpful for me in the process of hiring and might give you an inside scoop on getting hired. I love this question. Sydney Anderson says, can you share some things to say or do to comfort after infant loss from a nurse's perspective? I love this question. I think it's so beautiful. We actually have an entire module or month course in our mentorship all about bereavement. And this was like, first of all, a very challenging piece and is not the part about our job that we love, right? But also such an opportunity, especially when we're used to the happy births and life into the world. When you have an infant loss or a bereavement case, that can be particularly challenging, not only for the patient, but also for the nurse. And just to acknowledge that, like, it's challenging. I know there have been plenty of times that I've gone home and wept, or I've had to step outside of the room and cry, or cried with families at the bedside because it's painful, right? And we get to walk into other people's vulnerability in these moments of their life that are so transformational, also some of the hardest things that anybody can go through. And so my first tip for you when you're talking to somebody or you're caring for a family that has an infant loss or a stillbirth or that they're bereaved in the moment would be actually to acknowledge their loss. I think one of the things that we walk into that case, or even with when anybody's lost anyone, it's hard to sort of tiptoe around the topic and like, oh, should I say something? I don't want to bring it up. I don't want to offend someone. Instead, what we find time and time again is just how validating it feels and how cared for people feel when you say something like, hey, I'm Sarah. I'm going to be your nurse today. I know this isn't the ideal scenario. I know this is not why you wanted to be here, and I'm so sorry that you are going through this. I'm so sorry for your loss. I'm here to give you the best care possible that I can and hopefully help to make your day just a little bit less painful, a little bit easier today. So if there's anything I can do to make this day easier, whether that be simple or complex, I'm here to really go out of my way for you to help to support you during this time. Something like that. And mind you, that was kind of a lot. And so it could be as simple as, I'm sorry for your loss. I feel for you. This has to be so challenging. And then they're like, thank you. Yes, this might be the first time somebody's, rather than just come in and do your tasks. Start off with introducing yourself and just acknowledge the elephant in the room from the very beginning. That could be really, really helpful. The other thing is just creating space to listen, asking, do you want me to stay here or do you want some time alone? And really opening up those lines of communication at first interaction and kind of setting the tone from the very beginning. Because I think too, you kind of get going with your shift and then you've had these interactions and then you're like, oh, now it feels awkward to like go there. Whereas if you come in and you open it up like that and then say, look, I'm going to ask you what you need during here. I'm going to give you some simple options. And if there's anything else I can do, please, like, this is open lines of communication. There's no right or wrong here. There's no right or wrong way to grieve. This is a safe space and I want you to be able to let loose when whatever way feels best for you right here. And then, like I said before, it's like, do you want me to stay or do you want some time? Do your task. Yeah, I think I'd want you to stay here. Then grab your stuff and just be a therapeutic presence. Be open. The other tip that we learned through our bereavement module, which is totally an insider scoop for mentorship, is to actually ask, have you been thinking about what happened to your baby? Unless it's a clear reason why the baby passed, what we find is that a lot of families actually want to talk about that. They want to process, was it their fault? And a lot of times there's a lot of guilt going on of I went running in the morning that morning and maybe that was why, or I had a glass of alcohol last week, or it could be I didn't exercise in my pregnancy, simple things like that did not cause the death, but at the same time might be mulling on in their head. And so either you, if it's simple, and this is where you kind of have to watch your scope of practice, you can bring in the provider to have these conversations and identify those issues of what might be going on in their head for the cause. Because if it's not identified at some point, that person may live with that guilt of I did this, or I'm so concerned about this. And I've seen this in my birth debriefs that I do with clients where they're stuck on something that was the cause that really had no significance. And the moment they're able to hear from a professional perspective that it didn't actually affect the outcome, they can let it go and begin to move closer to healing. Nicole Hamlet says, what do you say to motivate patients who need to change positions but just sit in bed? This is such a good question. I was so excited to see this question on here because we know that if you're a patient, so position changes and movement help facilitate birth. We need you moving, even with an epidural, to be changing positions every 30 minutes, 45-hour max in labor is going to help that baby rock and roll down your pelvis and eventually, hopefully, come out. So if you as a nurse are sitting and your patient is like, no, I just want to lay here, instead, I would give them the rationale and say, hey, so I know you're really comfortable here in this position. I want you to settle in, and then in about 30 minutes, I'm gonna come back, and then I'm gonna really highly recommend that we change positions. They're like, oh, I don't want to, blah, blah, blah. The reason why is right now your baby is sitting in this position, and once we move the shape of your pelvis, it's gonna help speed up labor, and it's gonna help this baby kind of rotate and come down and out so that you can move closer to a vaginal birth. Most of the time, if you tell them the rationale, they're gonna be like, oh, okay. Or especially if they're without an epidural, I will say that they sort of have a lot more leniency to that if they're coping in a certain position, there's a balance between like coping and forcing them to do something else. And so that's when I would go through the lens of don't fix what's not broken. So if their labor is progressing, if their cervix is changing and they're really making moves towards vaginal birth and they're really in one position without an epidural, then I just let them be. But if you notice that you check them and 4 hours later their exam is still the same, then that's when I would use the rationale and say, I know you're so comfortable here. I really think it's gonna help you to help keep changing your cervix if we can rotate this baby in different ways to help them come down. Otherwise, we may be here for a while. And most of the time, if you can motivate them with the rationale, they're gonna be much more motivated to listen to you. But then instead of just move, give them an option, give them a reason. And this is why you take our physiologic birth class, because I show you how to move and what positions for each one. The other thing, and actually I was gonna use this for the labor bag question, but our position guide that we sell, and I'll link it down below, this is for patients or for nurses, can also help where you're like, what sounds good? And then you give them an option, you put the control back in their hand and they're like, ooh, that one looks really good. Like that I think would really help me. And then you can try it together. You're giving them options rather than just being like, you need to move. Grace Bounding All Them, with some other word that's missing, says, what's the best advice you received when starting L&D? Love this question. Actually, I saw it earlier and I was like, I don't think I got any advice. I don't remember like one moment where someone was like, told me this thing and I was like, yes, and I latched onto it forever, which actually I think is a lesson for all of us to give advice to new nurses and help them to grow, because rather than just winging it, I think we have a lot of wisdom to pass on to each other. So the one that I came up with though was that when you know the process of an emergency, you don't necessarily have to experience the emergency to know how to respond. And so that's why doing the work ahead of time to know, say with a cord prolapse, what are the steps to a cord prolapse, so that when it happens, and it really truly is when it happens, then instead of being like, deer in the headlights, you have something to work with, right? And so that knowledge of resuscitation or what to do in a cord prolapse or a hemorrhage or whatever, even if there are little gaps missing because you've never done it, that knowledge does come back. And I will say from experience, the first baby that I had to resuscitate and do like a full code on, I like didn't even know how I knew what I was doing. But next thing I knew, I was bagging the kid, and then the nurse came in and I took over chest compressions, and it was like boom, boom. And I'd never done it before, but because I had like obsessed so much over the knowledge, it sort of does become second nature. So trust in the knowledge that you know would be one thing that I do remember having a conversation about from a while ago. The other thing I would say as far as my piece of advice for all of you labor and delivery nurses is, one, just let go, okay? And one of the things we teach in mentorship is this phrase that I sort of learned and taught myself early on when I felt stupid, because no one likes feeling stupid, is that I would tell myself, I'm not stupid, I'm just learning. And that to me, I feel like can be very powerful, because there will be moments when you're like, oh my gosh, I didn't know that, or oops, did I miss it? Or I almost missed it. And then you go home and you mull over it and you're like, I wish I blah, blah, blah. But the answer is, you're not stupid. You're not dumb, right? You're learning. And that's a piece of why you have a preceptorship and what it is to be new. There will be things that you've never seen before that you see, that you conquer, you overcome, you learn, you build from, right? And so no one can expect you to have had all of those scenarios before you come. No one expects you really to have anything, by the way. That's the insider scoop of being a labor and delivery nurse. Till you're an actual nurse on the floor, no one really expects much of you other than having the back knowledge, so that we're not starting with like, what's a vein when you're finding a vein, and what's an IV needle? Like, no, like that's too much, right? So instead you have that base knowledge, but then you're learning to apply it. We say you become a nurse when you've been practicing, not when you pass your NCLEX, which is when you become a nurse, actually. So, but remember that you're not stupid, you're just learning, that process is lifelong. We are always learning. And when you have those moments where you may feel like, I didn't know, or I feel really stupid, to remember me tell you, you're not stupid, you're just learning. Mulvena says, what are some things every L&D nurse should have in their work bag? Books, resources, tools, etc. I am super simple. I started out as a labor and delivery nurse, and I had like a whole backpack of supplies with like a reflex hammer and like a little pen light to check pupils. And I will say in labor and delivery, we rarely check pupils. So I would say, honestly, you need a pen, You need maybe like a little notebook to take notes in for things you're learning or things that like, ooh, I need to look that up later. And then I will say our position guide, which is why I pulled it out, because this thing has been super helpful for nurses when they bring to the bedside, and if they're stuck, if they're trying to continue to make change. It also has the Lavonne circuit on it, which is my like process for asynclitic babies or even OP, or even just a stalled labor for a process to get them going. We also sell a badge buddy guide that comes with our physiologic birth workshop, but that has my labor warm up on it that can be really helpful as a tool for you. Throw in your, I'm telling you all of our merch, which wasn't my intent, but I guess you should bring it with you, which is kind of the point. We also have our team underwear pins up online that helps identify you as a nurse that will offer underwear, which really just means that we're gonna offer choices to our patient. We're gonna give them autonomy over their body. We're not gonna force them to do anything. And so part of that is, I'm gonna say to you, do you wanna wear some underwear? And how little that little thing can be, but for the patient means so much of, wow, she's listening to me. Wow, yeah, actually, I don't want to be commando. It would help me feel more safe and comfortable if I could wear underwear. And so it's this movement. Now, if you're a patient or a doula, also this pin is for you to help identify, hey, we're in it together. We're going to listen. We're going to work. We're going to actually know you by name, and we're going to treat you with the autonomy and the respect and the power that you deserve. So I would definitely have a position guide. I would have some snacks, maybe like I always have caffeine, so like even a 5-hour energy, or I drink Celsius or Alani that like I bring to everywhere, a Verb bar that has a little bit of caffeine in it. I have a link for Verb that I can link down below because I think we have like a really crazy promo code for you to start out for like a starter pack for super cheap. So I'll link that down below. Otherwise, you don't need much. A stethoscope, I will say as well, because I do believe in actually listening to their lungs and having the capability, even for a baby, that a lot of times you see labor and delivery nurses, we sort of like slack off and stop wearing our stethoscopes, when like a stethoscope is a really helpful tool if you ever have an emergency to be able to auscultate the lungs, auscultate the baby, and listen for breath sounds in a baby as well. So I find that really helpful. And then last but not least, I have a bunch of questions about becoming a doula. So this also applies if you're a patient, and I get a lot of these kind of questions or even DMs from you guys asking and saying, hey, I really love my birth experience, or maybe I didn't love my birth experience. I feel really passionate about birth and I want to help mamas or birthing people. And so how do you get into the doula business? Now, from a labor and delivery nurse perspective, I do function as a doula. I call myself a labor nurse and birth coach because I am a nurse and I have a license. And so the questions have been, would you recommend being a doula if you're having a difficult time changing into a specialty of L&D, or what's the best course to become a doula? I'm a nurse. So if you're a nurse, I will say, that I think a doula course is really helpful, but I think you probably have the skills to be a doula without taking a doula course. I took one, it was super helpful. I took one by Dona International here in LA, and so I can link them down below. Dona and Kappa are probably the most reputable doula training companies. And then, so take a doula course so you sort of understand the business side of it. And then if you don't know comfort measures, you don't feel comfortable with laboring without an epidural, we do have a coping with labor class that you can take. I have one for patients, and that will be really helpful for you as a doula. And then I also have one for nurses that's a part of our mentorship, and then coming as a standalone that you can purchase soon-ish as well. And so you need some sort of class in coping, I think is helpful. And then you also need to know the legal side of functioning as an RN and also a doula. And so having really strong contracts, having an attorney on that you do actually use, I would say, especially when you're trying to protect a license, that to me is a necessary investment. Otherwise, the course I would recommend would be Dona Kappa, and then trying. Like, I think one of the most helpful things as you're feeling out the career would be to find somebody that you sort of know, or maybe that you could do for free or for a limited cost, where you could sort of feel out, and then it's less pressure that you're there. You know, they're not really paying top dollar where you have to perform, where you have to like provide this service when you're feeling out your feelers. I do think that if you're trying to break into labor and delivery, that becoming a doula may be helpful, and actually I know it would be helpful in giving you experience at the bedside to learn about birth, to learn the like physiologic side of birth, rather than going straight in without that experience. So I do think it would definitely help you. And I know there's a bunch of nurses or a few nurses in our mentorship program that have done both as well, and definitely see the overlap So yes, if you can swing it, I will say the doula lifestyle is challenging of being on call and not being able to leave and like at the drop of a hat. Even currently I'm on call for a client. So if she called me right now, I'd be like, ooh, okay, so it's been a great day and I'll talk to you later, bye. And I'd have to leave and go to her. Okay, so thinking about your lifestyle, taking a course, setting up your contracts if you're a nurse, and also if you're not a nurse as well, you wanna have study contracts as well. And then practicing with a client, with a friend, with somebody who you feel like needs the support or who's maybe requesting the support that's a little lower pressure than it being like your official business. Those would be my recommendations for becoming a doula for now. If you want a full video on that though, that like I could talk about for days. I in fact have a course brewing in my head. So if you also want to be trained by me to be a doula or a birth coach, please let me know down below and I will see the interest and maybe push that to the front of the priority list because it is a dream of mine. Thanks everyone for being with me here today. Thank you so much for your questions. Thank you to you nurses who give your hearts and souls to these patients and you show up for them time and time again. I know there's a question on here about like, what do you do with burnt out nurses on your unit? What do you say to them? And I would say if you're feeling burnt out or if you're feeling uninspired or if you're walking into a unit where you see a lot of the negativity or the burnt outness, which is very common. I think there's a stat or a study I read recently that was like 60% of nurses would be considered burnt out. I'm like, whoa. We need new inspiration. And so that's where I want you to know that we are here for you here at Bundle Birth. We want to train you. We want to support you. We want to educate you and help inspire you to feel better at your job, to remember your mission. And so I will link everything for Bundle Birth nurses down below. Check that out. We have tons of options for you. We have a new whole set of things coming. So make sure you subscribe to our mailing list so that you can get notified when we have new things coming for that. If you are a patient, I hope you also found this really helpful and interesting to hear the insider scoop about labor and delivery nursing. Make sure you check out my website, bundlebirth.com. I'll link that down below. I have lots of other classes over there. And then until next time, don't forget to flex and flow, and I will see you very soon. Bye. My name's Sarah Lavonne, and welcome back to my nursing channel. Give them the rationale. Wow. Nah, I don't like that. No, moving on. And then until further time? Anything else I need to say? Or a labor and delivery nurse friend, and then let's get going. I totally spilled on myself. Did you see it?